Welcome to Talk Me Healthy. My name is Scherrie Keating, founder, Diabetes Care Consulting. The goal of Talk Me Healthy is to provide you education on how to live your best life every day starting today. Each show will bring a different health-related topic and exciting guests to share their expertise, passion, and personal stories. My hope is you will hear something that motivates you to make a small step towards living a healthier, happier life. Hi, this is Scherrie Keating. Welcome to Talk Me Healthy. Today's show is going to be an exciting show. I have a great guest and a good friend, and we're going to be talking about cardiovascular disease and cardiopulmonary rehab. So my guest is Michelle Jones, and hi Michelle, how are you?
I'm great. Thanks for having me on today.
Oh, you're so welcome. I'm so excited to have you. Michelle is actually from Terrace Rehabilitation Healthcare Center in Lancaster. And she is on today to share the exciting news about the new cardiopulmonary rehab at Terrace. So thank you.
You're welcome.
Cardiac disease is actually one of my passions. I've been a cardiac nurse for 34 years, and I've actually worked and managed a cardiac rehab program. So this is a very comfortable subject for me today.
Excellent.
So tell us a little about yourself.
As Scherrie said, I'm Michelle Jones. I live in Lancaster. I've been a lifelong resident of Lancaster, Clinton, and Sterling. I belong on the Lancaster Council on Aging, and I've been in healthcare now for 34 years. My very first job was at 16 at Terrace as a nursing assistant. So I feel like I've come full circle. I just came back to Terrace as the community liaison about 3 years ago.
Okay. Yeah. Now, where did you go when you left there, and then, before you came back?
So when I left, I was 19, and I started a family and raised my children. And then when they went school age, I went back to work first in assisted living, doing admissions and marketing there. I worked for Worcester County Hospital, which is no longer, but I worked there for quite a while. I worked for a health plan for a little bit, and then came back to long-term care.
We always go home, don't we?
We sure do.
Because I started as a candy striper at Burbank Hospital, and then I was a nurse's aide all through nursing school. I became a nurse, and I worked in the ICU with cardiac patients, and then I went into cardiac rehab because I really wanted to see what happens when you leave the ICU as a cardiac patient. Exactly. What happens to your life? So I became interested in cardiac rehab, and then I ended up when the two hospitals merged, Leominster and Burbank, I ended up losing my job. And so I had an opportunity to start a cardiac rehab program in Athol, and I did that. But my home was always back in Fitchburg at Burbank. Yes. And so I ended up coming back and starting the diabetes program. And then my dream job came up, and that was the manager of the cardiac rehab in Leominster. And then I managed that for many, many years. So I love being home.
And I can tell it's something that you're passionate about.
I am. I love it. It's something that I've done my whole career. And so I definitely, that and diabetes, they're very connected. So exactly. Yep, that's definitely my passion. So before we get into starting to talk about the new cardiopulmonary rehab at your facility, I just want to talk a little bit to the viewers about cardiovascular disease. Boy, I'll tell you, I was reviewing the 2017 American Heart Association statistics, and boy, they're very scary.
Okay, sure.
I'll give you a couple of the statistics. Cardiovascular disease, 1 in 3 deaths are due to cardiovascular disease. They're saying 2,200 a day die from cardiovascular disease. That is 1 every 40 seconds. So we're sitting here for, say, a half an hour. How many people have passed away from cardiovascular disease while we're sitting here?
Exactly.
And so I hope this show today, people will understand who's at risk, and that there is options for strengthening your heart, and especially after a cardiac event, and that's cardiopulmonary rehab. So, don't let these statistics scare you, because there's definitely help out there. And there are things that you can do every day to make a difference in your long-term heart care.
Of course.
So some of the other statistics that kind of just, I guess, I've been a nurse as a cardiac nurse for all these years, but when you look at the statistics,
It's mind-blowing.
It is. Yeah. It's a different story. So the heart disease statistics, it is the number one cause of death in the United States. And every 40 seconds seemed to be a theme when I was reading the statistics. 40 seconds, someone will die of cardiovascular disease. Every 40 seconds, someone will have a heart attack. And every 40 seconds, someone will have a stroke.
Wow.
So when you're talking about cardiovascular disease, you're talking about the disease of the arteries, your heart, the vascular part of the body. And so you're talking about strokes, you're talking about high blood pressure, you're talking about the heart and all the related heart problems that you can have. So cardiac rehab is one of the options. There's kind of like a recipe book when you have a heart problem. There's certain medications that you go on, but really your heart has been potentially damaged and you really need to strengthen that. And cardiac rehab is an avenue to do that.
Exactly.
Research actually shows that people live longer if they go to cardiac rehab. And the longer they stick with cardiac rehab, the longer they will live. And it's proven. And what I never understood as a cardiac rehab nurse is that it's very underutilized. The statistics show only a third of the people, and even less sometimes, actually go to cardiac rehab that should. That's true. It isn't for everybody because of certain physical limitations, but it is for most people.
Sure. And there are different types of cardiac rehab
That's
as well.
Right.
There's inpatient cardiac rehab in the hospital setting to start to learn the tools you need to know to get better and stay better.
And that's called phase 1, actually.
Yes.
Yeah.
And then when you leave the hospital, there may be an inpatient program like at River Terrace. People come to us for short-term rehab. The intention is to go home healthier with the information they need to work with a rehab team to get stronger and safer to go home. And that's another inpatient option. And then there's outpatient cardiac rehab as well. So there are lots of different layers now to cardiac rehab than there ever were before.
Right, and the only layers that I knew is that when you have your heart event, so to speak, whether it's a heart attack, valve, whether you have bypass surgery, a transplant, you actually get the emergency information you need to know to go home safely.
Right.
And then you go into the outpatient cardiac rehab. You're on a heart monitor. It's medically supervised by a cardiologist usually, and you're on a heart monitor and you're prescribed a certain type of exercise that you progress through the program, and it's based on a stress test usually, and you have nurses and exercise physiologists monitoring you all the time, and you're also being educated on how to live with heart disease. And that can go anywhere up to 36 visits or 12 weeks. And then you go into like a maintenance program. And that's a lot of times a transition period and then a self-pay to continue doing that for the rest of your life.
Exactly.
And now I haven't heard of the inpatient piece that you're talking about.
Exactly.
So I'm really excited to hear about what you guys are doing there.
Well, let me start at the beginning, and that's that River Terrace introduced a pulmonary rehab program some 1.5 to 2 years ago. We have a pulmonologist that's the medical director for that program specifically. We were noticing that a lot of people coming in for different types of rehab, orthopedic, whatever it was, they had an underlying diagnosis that was pulmonary in nature. Then over time, we noticed that people had a pulmonary diagnosis, whether it was primary or secondary, also had cardiac diagnoses. We saw the two going hand in hand. So we decided to introduce a cardiopulmonary rehab program for those patients. So we have a medical director, Dr. Daniela Capriles. She manages our cardiac rehab. We have the pulmonary with Dr. Corey Salton from Mass Lung and Allergy, and they work hand in hand on those dual diagnoses patients. They do come in after a hospital stay. Typically, they have their cardiac event, go to the hospital, come to us. The goal is we'd like to get them turned around and back home within 1 to 2 weeks. So get stronger with our physical therapy, occupational therapy. Sometimes if they've had a stroke, we work with speech therapy, and we have employees that cover all of those different areas. We have therapies 7 days a week. So people can have their rehab on a weekend as well. And some people do better later in the afternoon or earlier in the morning. And then the goal is to give them, like you said, the tools they need, the information they need. We have a registered dietitian, nutritionist that will meet with each cardiac rehab patient, talk about the changes, the lifestyle changes they need to make so when they go home they're successful and there's less of a chance of a readmission to the hospital.
And you said lifestyle changes. The risk factors for cardiovascular disease are a lot of times related to lifestyle.
Exactly.
Just like diabetes. There are so many diseases that can be preventable based upon lifestyle. And so some of the risk factors are men over 50. If you have a history of elevated blood pressure, you have a history of elevated cholesterol, you're overweight, you're sedentary, you smoke, diabetes is a risk factor.
Sure.
In fact, diabetics are 50% higher risk of dying from a heart problem than a non-diabetic. So there are a lot of things, and it all goes back to what we eat and how much activity that we get.
Exactly.
So if anything that you hear today resonates with you, I hope it's healthy eating and exercise is going to impact not only cardiovascular disease, but so many other diseases and you can live a longer, healthier life. If you just make a small change in those two areas, you're going to have a big impact.
Exactly. We also send our cardiac rehab patients home with a checklist of things they should be doing every day, like weighing yourself at the same time every day with the same scale and keeping track of that weight. Is there fluid retention? And when it's appropriate to call the doctor or when you should go to the emergency room. And if people get into a routine that way where they're documenting for a couple of weeks, documenting their daily checklist, so to speak, then after a while, it takes about 2 weeks to start a new habit. After a while, it becomes habit. And people who are committed to their heart health, and like you said, diabetes and other diseases, committed to being healthier, it becomes second nature to them.
Right.
That's the goal.
Yeah, and that is the goal for anything health-wise. I think you just want it to become part of your life. It's not supposed to be a burden. Exactly. It's supposed to be really just part of your everyday living.
Yeah. And you hear time and time again people say, I'm on a new diet, or I've made a goal to go to the gym 3 times a week. That's not a diet or a goal. It's a lifestyle change.
Right.
It's a commitment, and we want to help. And our social worker also helps with people, getting on that track, how to manage everything that's going on in their lives right now.
So in the outpatient, the type of program that I'm used to in the outpatient, they come in, we do a assessment on them, we identify all of their physical limitations so that we can prescribe an appropriate exercise program. They have a stress test that actually tells us where their heart rate, it's safe to get their heart rate to, because they're recovering from a cardiac event. Right. So we don't want to push their heart, but we want to strengthen their heart muscle and improve the oxygen to their heart muscle and to their lungs. So we start them slow, and they learn stretching exercises. They go on aerobic equipment. They do some light weight training if it's appropriate. We listen to their lungs. We take their blood pressure. We educate them on the safe exercise process. We have them start a home program so that when they leave us, they're already in that routine.
Right.
They meet and have education classes with nurses and diabetic nurses and pharmacists, and they go on a supermarket tour. So they learn, like you say, they leave with their toolbox filled with tools to prevent death from after a cardiac event.
Exactly.
And to make their heart muscle stronger so they live longer. Right. Plus, we also help with the emotional part. They're in a room, the camaraderie that happens when people have it's a scary. Sometimes it's a wake-up call for people.
Of course.
And sometimes people are so afraid to do anything because they've had a heart attack. So, we help with that emotional side too, and that's really important. Sure. And, we don't want to downplay that because that's real, that's important, and people really need help to move on, because until they acknowledge that, yes, this has happened to them, they can't change what they did maybe to help progress this, but we can take steps forward. So I always try to tell them, you can't change what you didn't do or did do in the past. So let's just start today, wipe the slate clean, and let's move forward and use the tools that we give you to make improvements.
Exactly. And you spoke very well to what happens in the outpatient setting for cardiac rehab. I'd like to mention some of the things that happen.
I was just going to ask you the difference.
Yeah.
Yes.
So, and I'm referring to our most recent material. So our cardiopulmonary program features 7 days a week physical therapy services as prescribed by a doctor. We have 24/7 access to lab and radiology services. We provide tracheostomy care and management for the pulmonary piece of our cardiopulmonary. We do on-site echocardiograms and EKGs.
That's cool. great.
Yeah, we do a wide range of oxygen therapies, and we have remote monitored in-house telemetry. So people can be on the telemetry in the building, and not only do we have access to what's happening to them in live time, but also we have contracted with an agency who has cardiologists 24/7 monitoring the events that are going on, and they can contact the building, or they can contact Dr. Capriles directly if there's something they see that needs to be addressed right away. So this is very clinical in nature. It's something that we're finding is not happening everywhere, and we're really, really excited about it. Also, more on the pulmonary side, the nebulizer therapies. We do pacemaker assessments and monitorings as well. We have a LifeVest wearable defibrillator that our staff has been trained on. We do anticoagulation checks on site instead of sending somebody out to the hospital. We have a cardiac IV medication, push medication if necessary. And we have cardiac and pulmonary education and training, not only for our staff, but also for the patients and their families before they return home. So if, for example, we have a CPR certification course happening, our patient families can come and participate in that.
That's great, and that's so important because I think it helps the family feel like they have more control over what's going to happen, because I'm sure their fear level is just as high as the patient's.
Through the roof, absolutely.
Yes. So that's a great benefit. Do you have more?
Oh, yes, we have, of course, case management and discharge planning.
Okay.
We'll arrange for services to come into the patient's home once they return home to provide them with help with housekeeping and laundry services while they continue to recover, or with a home health aide to come in and help with personal care, or for a nurse to come in and help continue to educate them in the home. And we also can do direct admissions from the emergency room 24/7. So if somebody comes to the emergency room and it wasn't a major cardiac event, in order for them to go ahead and get admitted, but they could use a little something before they go home, a little strengthening, they can come to us directly from the emergency room.
That's great, because a lot of times there was a wait list to get in. And so while they're sitting at home, they're scared. They're not doing anything. They're getting very deconditioned. And then so we're starting further away from the goal that we wanted to by the time they got there. So this is a great kind of bridge to the outpatient at the hospital.
Exactly.
And it sounds like you guys have covered all the bases. You have a great system in place there. And when did you open?
We opened up in the spring.
Okay.
We worked very hard with the American Heart Association and their tools to help us to develop the program. We worked with other facilities like ours within the marquee, our parent company's realm, and found out what they were doing in their buildings, what they liked about their programs, what they didn't like about their programs. Kind of took all the information together and built the program that we wanted.
That's great. And how many people have gone through the program to date?
Oh boy, I really don't know off the top of my head. But I know, like, at any given time, maybe it's not their primary diagnosis and they're having the cardiopulmonary rehab as a secondary measure. But
so you can do that. So say you're there already for another problem.
You fell and broke your hip and you're there for orthopedic rehab. If you have an underlying diagnosis of cardio or pulmonary that needs to be addressed because you're not managing it well, we can have Dr. Capriles or Dr. Salton see you as well.
And then they need an order to go into the program?
Exactly.
Okay. And how about insurance? Now, they're already there. So say someone's already there.
Yes.
The addition of this type of program, is that covered? And what if somebody's coming from the ER? And how is that covered?
So if patients are already with us, because we do have a long-term care portion of our building for traditional nursing home care, if they need the cardiac rehab as well, because it might be something new that's occurred or something that, really wasn't addressed to its fullest extent in the past with their outpatient cardiac rehab, then we will have Dr. Capriles meet with them and work with them. So when you're in long-term care in a nursing home setting, there are two types of payment systems. There's Medicaid and private pay. And as long as the doctor's writing the order for this type of care, the Medicaid will pick up the cost of that. If people come to us from either an inpatient setting or from the emergency room, then it's Medicare is the insurance that would cover their stay, or if they have an insurance that works hand in hand with Medicare. Some of the commercial insurers, they will pick up that portion of the stay as well.
Because in the outpatient cardiac rehab programs, Medicare will pay, like, say 80% or a certain percentage, and then I think that was some of the problem, is the co-pays in outpatient really kept people from attending this very beneficial program because
Exactly.
of the secondary insurance may not have picked up, or the Medicare didn't pay enough, or
Right.
so insurance can be a barrier.
Yes.
But it sounds like in
Yeah.
this type of rehab, it isn't a barrier.
And we do have contracts with the major insurers. There aren't many insurances we don't accept, and we have good relationships with the insurers. So our clinical team works with the insurance companies to make sure the patient is being discharged at the appropriate time and has the skills they need to be successful and safe at home.
So you said the program's about 2 weeks.
Yeah, 1 to 2 weeks is the goal.
Okay, and what do you have for staff?
So we have registered nurse, of course, is our director of nursing. We have nursing supervisors that cover the different wings of our facility. East wing is the short-term rehab wing, and they have their own nursing supervisor on each shift. We have like LPNs and RNs, with some of them pass medications, some do treatments, and then we have certified nurses aides through the American Red Cross program. And we have staff 24/7.
That is awesome.
Exactly.
That sounds like a great, I love the fact, when I was in cardiac rehab, I don't think I ever heard of a facility having this kind of bridge program.
There are other facilities that started out with the pulmonary and have done the cardiac program separately, and they seem a little bit disjointed to me. By working hand in hand, it's a benefit to the patient.
Absolutely, and I know that Health Alliance has always had cardiac rehab, but now they've had a pulmonary rehab program that
Exactly.
opened recently.
Yeah, and Mass Lung Analogy is located right there
Right.
at the hospital. We've had a great relationship with that group for years, and Dr. Salt and his patients love him, and our residents do too.
And so do I. He happens to be my pulmonologist, and I love him as well.
See.
He's just a great guy. So that's wonderful. So tell me a little bit more about River Terrace in terms
Yes.
of, I've heard that they were deficiency free.
That is true. Our most recent survey was deficiency free. The Department of Public Health in the state of Massachusetts yearly enters each skilled nursing facility, which is what we are. We provide short-term and long-term care. They enter each facility once a year, and they inspect different sections of our building. They want to look at the physical plant. They want to look at our record keeping, our quality care. They look into everything, and they're usually there for about 1 to 3 days. And we've been very fortunate to have the deficiency-free survey. It doesn't happen very often. And so when it does, for any place, it doesn't happen very often. So when it does, we love it. We know that we have a great team. We know that we provide quality care, but to actually see it in writing,
Right. And be acknowledged for that you
and
provide.
anybody can visit a website that the state has put out. It's called Medicare.gov. When you go to that website and click on Nursing Home Compare, you can bring up by zip code any facilities up to 5, I believe, and compare them side by side and see what their star ratings are. So people can, use that as a benchmark for making their decisions. I have, over the years, have encouraged people to do their shopping, so to speak, for both short-term rehab, including the cardiopulmonary, and long-term care. Do it while you're well, because no one knows when the need is going to arise. No one knows when something's going to happen. And if I had $1 for over the years, every time someone came to me and said, my mother's in the hospital, she's being discharged tomorrow, she's going to rehab, and we have never done this before. We have no idea where to even begin. I encourage people to tour a couple of different facilities, because although we all offer the same vanilla services, so to speak, meals, housekeeping, laundry, activities, and rehab and nursing care, we all package it differently.
Right.
So people need to know what's important to them when they come for a tour, and when they leave, they'll know in their heart if it's someplace they can imagine themselves or a loved one.
I think that's great advice, because I know that when my dad had dementia and my mom was looking for respite, they were kind of, they only had limited choices because the VA was paying for it, but still, they did have choices,
Right.
and my mom did shop. And I think today's world, you need to be an informed consumer, no matter what, whether it's going to a specialist. You want to shop around. You want to, because you're going to be forming a relationship with that person, and the same forming a relationship with your facility and your staff, and you want it to be a good fit, because one size doesn't fit all.
That's
so.
very true.
Yeah.
We enjoy a 96% customer satisfaction rating, and that is what makes every building different, is your customer service. It
And
really
isn't
is.
that for everything, customer service?
Exactly.
Because that's what people want, especially when you're sick. You want that little loving type of care, just like you would get at home.
Exactly.
And that's what you're looking for when you do have to go into a facility, whether it's for short-term or long-term.
And one of our goals at River Terrace is to provide these clinically complex programs while still maintain that home-like atmosphere. We're very clean. Our facility is up to date, so to speak. However, we still have that nice small team that treats every resident as an individual and like they're our family.
Right.
And when you have a smaller building like ours, you're able to do that.
Well, that's wonderful. I think that's so important when you're sick. You want to be treated like family. You want the staff to treat your loved one like they were your mother or their father or brother or sister. So I think that's wonderful and deficiency-free. Congratulations.
Thank you very much.
And this is so exciting about the new program because it really is life-saving. And, I just wish that more people would utilize this. So I'm hoping that our conversation today and the fact that cardiovascular disease really is 1 in 3 people die from this. So this is very serious. And if you have a heart event, first of all, if you have any chest pain, shortness of breath, if you have any lightheadedness, your heart is racing, you're sweating, you just don't feel right, don't stay at home and wait for it to go away. Take action. If you are definitely having chest pain for more than 5 minutes, you need to be resting during that 5 minutes and call 911. Don't have somebody take you to the hospital. Call 911 because if you had a heart attack on the way to the hospital, it could cause an accident and you could get hurt yourself or hurt somebody else, and I know you wouldn't want to do that. And the ambulance has the tools that are needed to help save your heart muscles because time is heart muscle. And it doesn't take long to have permanent damage to your heart muscle. So women have non-traditional symptoms. So they have more of the GI symptoms, the heartburn, the upset stomach, maybe some thinking it's reflux. So definitely if you have symptoms, you've never had a heart problem before, always it's better to be checked out. No one is going to say, why did you come here? Go and call 911 and get checked out.
I spoke with an EMT recently who said to me about cardiac disease and the calls that they get on 911. I'd rather come and pick you up at your house and have a nice conversation like we're having now on the way to the hospital and find out it was something else than to come to your home and it's too late.
Right, because your heart could stop and there's nobody there to help you. And so absolutely, definitely take action. And heart pain can be a lot of different things. It's not, on TV, they clutch their chest, they fall to the floor. That's TV. That's not, for some people that may be reality, but a lot of people get numbness down their arm. They may sweat, they may feel nauseous, they may, feel dizzy or lightheaded. They may have indigestion. So it can be a lot of different forms. So definitely, take it seriously. Don't wait at home. Don't say, oh, I'm going to lay down and take a nap. It will go away when I come back. Just go get it checked out.
Exactly.
Definitely.
Good advice.
So, this has been great. I'm so excited for you guys.
Thank you.
I can't wait to actually go there and see this program in action. And I hope someday I will get a chance to do that.
You're welcome
and
anytime.
So I want to close with, what do you think is the message you want to leave with our viewers today that will really impact their preventing heart disease as well as getting into a cardiopulmonary rehab?
Thank you. Educate yourself. Educate yourself. If you already have a cardiology diagnosis, a cardiac diagnosis, educate yourself to the best of your ability about your disease. Know what the symptoms are. Know what's normal and what's not. And do your shopping ahead of time. Come and tour some facilities and just have that information in your back pocket, so to speak, so that if the time came that you need to be somewhere, that you know exactly where you want to go. Also, another thing is one of my roles as the community liaison and other facilities like us as well is to speak at senior centers, places where seniors go, assisted living communities. If you see any programs that are open to the public about whatever disease you're struggling with or whatever event might be happening. Come and educate yourself and ask those questions, because we want to answer your questions. We want you to be armed with information, so to speak. And then, like you said, know the risk factors for your disease. Know, commit to those lifestyle changes.
Yeah.
Don't think of it as denying yourself what you want to eat by going on a diet. Don't think of it as, oh, I can't go to the movies because I need to go to the gym. Think of it as saving your life.
Absolutely. And as a cancer survivor, trust me, your health means everything. Absolutely. So thank you. This has been
Scherrie.
wonderful, and I hope the viewers take a little piece of information and act upon it. And so I just want to thank you for coming in today, Michelle.
Thank you.
And how can somebody get more information or even come and enter the program?
Exactly. So our information will be up on the screen. We're located on Route 117 in Lancaster, which is Main Street. People can visit our website at riverterracerehab.com to learn more about us. And people can always come for a tour anytime, either walk-in tour or a appointment to take a tour. And if they are in the hospital, they're currently inpatient in the hospital or in the ER, and cardiac rehab is something that's being discussed, to know that they have choices about where they go, and their case manager will help to point them in the right direction. And if somebody mentions a facility in particular, then we will have our clinical liaison, my counterpart, who's a registered nurse, come and meet them and review their chart and talk with the doctor. And if they're a great fit for our program, we'd be happy to help them out.
That's great. Well, thank you so
Thank
much.
you.
And thank you, viewers, for tuning in today. Our next show is next month, and it's going to be on the opioid crisis and addiction. We're going to have a couple of guests that will share their personal stories, so I hope that you tune back in. And so I just want to leave you with to remember to start today to make those small lifestyle changes in your health, so that you can live your best life every day starting today. This is Scherrie Keating. Until next time, thank you very much.